Hi everyone. In the previous video, we have seen the anterior part of norma basalis, and now today in this video, we'll be learning about the middle part of norma basalis. So, the middle part of norma basalis is again divided into the median area and a lateral area. Basically, the middle part of norma basalis is present between the line at the posterior end of the hard palate, and second line is the arbitrary line or posterior arbitrary line, which is present at the anterior portion of the foramen magnum. So in between these two lines, the area which is present is the middle part of norma basalis. Now again, this middle part is divided into two parts. First is the median part, so this is the median part, and second is the lateral part on both the sides. So this median part is so this is the median area and this is the lateral area. This median area consists of basically two uh, major structures. First is the vomer bone, and second is the pharyngeal tubercle, or a broad bar of bone. This is a broad bar of bone which is formed by body of sphenoid and by the fusion of body of sphenoid and the basilar part of occipital bone. So this portion, this quadrilateral bar of bone, is formed by fusion of body of sphenoid, which is present over here, which is the portion of body of sphenoid, and second is the basilar part of occipital bone. So vomer bone and the basi occiput, these two are the major structures which are seen in the median area of middle part of norma basalis. Now, basically, the middle part of norma basalis has the vomer bone, and which is articulating with the palatine bone and the sphenoidal bone. So it looks something like this. The structure is something like this. So this green colored bone is the sphenoid bone. The lesser wing of sphenoid on both the sides, greater wing of sphenoid on both the sides. This is the body of sphenoid. This is sphenoidal rostrum, and this is the pterygoid process of sphenoid. Again, it is divided into two processes, the medial pterygoid plate and the lateral pterygoid plate. So this whole is the sphenoidal bone. Second, in this red colored bone is the palatine bone. So the palatine bone has the horizontal plate which forms the hard palate and the perpendicular plate. This perpendicular plate of palatine bone is again divided into the sphenoidal process. This is the sphenoidal process of palatine bone, and this is the orbital process of palatine bone. So this is the structure of palatine bone, and in the middle, this bone is the vomer bone. So this is the vomer bone. So this vomer bone, inferiorly, it articulates with the horizontal plate of palatine bones on both the sides. So this is the horizontal plate of palatine bone, and the vomer bone inferiorly articulates with the horizontal plate of palatine bone. Superiorly, this vomer bone. So the vomer bone. Superiorly, this vomer bone is bifurcated into two parts like this. So this is called the LA of vomer bone. The LA of vomer bone. This and this. And this median part articulates with this portion of the sphenoidal bone, which is the sphenoidal rostrum or rostrum of sphenoid. So this is the sphenoidal rostrum, and vomer bone articulates superiorly with sphenoidal rostrum and inferiorly with horizontal plate of palatine bone. So as we all know, this is the lesser wing of sphenoid, the greater wing. Now this portion, this process which is coming out from the pterygoid process, or the upper, this is the medial pterygoid plate and this is the lateral pterygoid plate. The upper end of medial pterygoid plate has a process which is called as vaginal process of medial pterygoid plate or vaginal process of sphenoidal bone. This vaginal process of sphenoidal bone has a groove-like structure in its inferior surface. And when there is presence of sphenoidal process of palatine bone, there is formation of a canal which is called as palatovaginal canal. So this is the sphenoidal process of palatine bone, and this is the vaginal process of sphenoidal bone. In between, there is presence of a canal which is called as palatovaginal canal. So this palatovaginal canal has a significance that it gets open into the pterygopalatine fossa. Now, Here the superior border of vaginal process and the LA of vomer bone on both the sides. Again, there is formation of a canal in between these, the superior border of vaginal process and the alley of vomer, and this canal is called as vomerovaginal canal. So this is the medial pterygoid plate, lateral pterygoid plate. This is the sphenoidal process of palatine bone and the orbital process of palatine bone, and the vaginal process of sphenoidal bone. This canal is the vomerovaginal canal, and this canal is the palatovaginal canal. So these two canals are present in the median area of middle part of norma basalis. So this is the palatovaginal canal and the vomerovaginal canal. Now with this we come to an end of the median area of middle part of norma basalis. Now we'll start with the lateral area of middle part of norma basalis. So this line, this arbitrary line which runs at the posterior end of hard palate, and second arbitrary line which runs from the anterior end of foramen magnum. So this is the middle part of norma basalis, and the median area of norma basalis we have already covered. So we'll see the lateral part of norma basalis, the middle part of lateral area of middle part of norma basalis. So basically it has two major bones. One is the sphenoidal bone and second is the temporal bone. Now this is the medial pterygoid plate of a sphenoidal bone and this is the lateral pterygoid plate. These two pterygoid plates are a major structure in the lateral area. Then second is the greater wing of sphenoid. This whole portion is the greater wing of sphenoid. Here and here as well, the greater wing of sphenoid. So the pterygoid plates and greater wing of sphenoid. So these are two parts of the sphenoidal bone which is seen in norma basalis. Then second is the temporal bone. So this triangular structure which is present in the middle is the petrous part of temporal bone. This is the petrous part of temporal bone. Now this whole area is the squamous part of temporal bone, and here there is presence of a triangular plate which is the tympanic plate of temporal bone. So basically two major bones are seen in the lateral area, the sphenoidal bone. Out of in that also there is presence of pterygoid plates and greater wing of sphenoid which are seen in norma basalis, and second major bone is the temporal bone which has three parts which are seen in norma basalis. First is the petrous temporal, second is the squamous temporal, and third is the tympanic plate of temporal bone. So these are these major bones or structures which are seen in lateral area of middle part of norma basalis. So coming to the pterygoid processes. The pterygoid process is this portion. This is a projection of a sphenoid bone which comes out at the area where the greater wing of sphenoid joins the body of sphenoid. So this whole pink colored structure is the greater wing of sphenoid and this blue is the body of sphenoid. At the junction of these two, the process comes or projection comes downwards, which is the pterygoid process of sphenoidal bone. This pterygoid process again has two plates, the lateral pterygoid plate, this is the lateral pterygoid plate, and second is the medial one, this is the medial pterygoid plate. So anteriorly, these two pterygoid plates are fused here, but posteriorly they are separated by a fossa-like structure which is called as the pterygoid fossa. So as we can see here, this is the pterygoid notch which separates the lateral pterygoid plate and the medial pterygoid plate. This whole structure is the pterygoid process, and then this is the medial pterygoid plate. When we see the medial pterygoid plate, it has a medial surface which is here, a lateral surface. This is the medial surface of medial pterygoid plate, a lateral surface posterior to this. Sorry, this is the lateral surface, a medial surface posterior to this, and a free posterior border. So medial pterygoid plate has basically two surfaces, a medial surface, a lateral surface, and a free posterior border. This is the free posterior border. Then this medial pterygoid plate is somewhat directing backwards. So the medial pterygoid plate has a mesial surface, a lateral surface, and a free posterior border, and it is usually directed backwards. Now this free posterior border, it has a depression like it has a projection at the low it has a projection at the inferior end of the medial pterygoid plate, which is called as pterygoid hamulus. At the upper end of this is the posterior view of sphenoidal bone. At the upper end of this medial pterygoid plate, there is a triangular fossa-like structure here and a triangular fossa-like structure here, which is called as the scaphoid fossa. This is the pterygoid fossa, which separates the medial and lateral pterygoid plates. And this one is the scaphoid fossa, which is present. It's a triangular fossa-like structure which is present at the upper end of the medial pterygoid plate. So, and the lower inferior portion of the medial pterygoid plate is it has a projection which is called as pterygoid hamulus. Coming to lateral pterygoid plates, so this is the lateral pterygoid plate. Again, it has a lateral surface, a medial surface, and a free posterior border. The lateral pterygoid plate also has a lateral surface, a medial surface, and a free posterior border. The lateral surface of lateral pterygoid plate, it forms the medial wall of infratemporal fossa. When we saw the infratemporal fossa, we have seen that the lateral pterygoid plate forms the medial wall of the infratemporal fossa. So this surface forms the medial wall of infratemporal fossa. And the free posterior border, sometimes it has a projection here, which is called as pterygospinous process. So these are the lateral and medial pterygoid plates. Now coming to greater wing of sphenoid. The portion, so this is the greater wing of sphenoid here and here. The portion of greater wing of sphenoid which is seen in the norma basalis is this portion, and this portion which is called as the infratemporal surface of greater wing of sphenoid. So it is a roughly pentagonal structure, the infratemporal surface of greater wing of sphenoid. It is a roughly pentagonal structure. Anteriorly, here it forms the posterior border of inferior orbital fissure. So this black colored fissural structure is the inferior orbital fissure. So the anterior margin of infratemporal surface of greater wing of sphenoid forms the posterior boundary of inferior orbital fissure. Then laterally it forms the infratemporal crest. So this portion is the infratemporal crest. Now if we come to the posterior lateral surface of this greater wing of sphenoid, it is articulated with the squamous temporal bone. So this is the squamous temporal bone, and the posterior lateral surface, posterior lateral border of greater wing of sphenoid is articulated with the squamous temporal. Now this is the posterior medial border of infratemporal surface of greater wing of sphenoid. This posterior medial border articulates with the petrous temporal bone. This whole area is the petrous temporal bone, and this border articulates with the petrous temporal bone. And medially, this portion, it is continuous with the body of sphenoid and the pterygoid process of sphenoid. So this structure, which is roughly pentagonal in shape, is the infratemporal surface of greater wing of sphenoid, which is seen in norma basalis. Anteriorly, it is continuous with the posterior border of inferior orbital fissure. Laterally, it forms the infraorbital crest. Posterior-medially, it articulates with the squamous temporal bone. Posterior-medially, it articulates with the petrous temporal bone, and medially, it is continuous with the body of sphenoid and the pterygoid process. The posterior most part, this portion of the greater wing of sphenoid is called as the spine of sphenoid. This is the spine of sphenoid. Now we'll see that in the greater wing of sphenoid, along its along the posteromedial border of greater wing of sphenoid, there are presence of few foramina. This is the foramen ovale. So foramen ovale is a large oval foramen which is present posterolateral to the upper end of posterior border of lateral pterygoid plate. So this is the posterior border of lateral pterygoid plate, and it's posteromedial to it there is presence of foramen, posterolateral to it there is presence of foramen ovale. Then this is again posterior and laterally there is presence of another foramen which is smaller in size. This is the foramen spinosum. Now this foramen which is sometimes which may be present anterior to foramen ovale in relation to the scaphoid fossa, as this is the medial pterygoid plate, and a triangular fossa at the upper end of medial pterygoid plate is called as the scaphoid fossa. So this foramen which might be present anterior to foramen ovale and between foramen ovale and scaphoid fossa is foramen basalis or emissary sphenoidal foramen. Then there might be presence of a small foramen here in between foramen ovale and foramen spinosum, which is called as canaliculus innominatus. And then there is a sulcus which is present between the posteromedial surface of greater wing of sphenoid and the petrous temporal bone. A sulcus like structure is present which is called as sulcus tubi. So this sulcus tubi, basically it is a groove which lodges the cartilaginous part of auditory tube or eustachian tube. So this sulcus, it lodges the cartilaginous part of auditory tube. So this is the posteromedial surface and important structures which are present in greater wing of sphenoid. So foramen, the clinical significance is foramen ovale, it transmits mandibular nerve, accessory meningeal artery, lesser petrosal nerve and emissary vein. Foramen spinosum, it transmits middle meningeal artery, middle meningeal vein, meningeal branch of mandibular nerve. Emissary sphenoidal foramen or foramen basalis, it transmits emissary vein which connects the pterygoid venous plexus to the cavernous sinus. Then canaliculus innominatus, it sometimes whenever it is present, it lodges the lesser petrosal nerve. And sulcus tubi lodges the cartilaginous part of auditory tube. So the structures which are transmitting through foramen ovale, there is a mnemonic for this, that is male, the mandibular nerve, the accessory meningeal artery, lesser petrosal nerve and emissary vein. Now coming to petrous temporal bone. So we have done with the pterygoid plates and the greater wing of sphenoid. Now coming to the temporal bone. So the portion which is present here, this is the petrous temporal bone. This is the petrous temporal bone. It is usually triangular with the apex. This might be the apex of the petrous temporal bone, um, which is present forward and medially. So it is directed forward and mesially. This apex of petrous temporal bone is directed forward and mesially. Then this apex is present between the greater wing of sphenoid. This is the posterior medial surface of greater wing of sphenoid and the basi occiput. This is the basi occiput or the basilar portion of occipital bone. Then it is this basi occiput and the petrous temporal bone are separated by a foramen which is called as foramen lacerum. This is the petrous temporal bone and this is foramen lacerum. Now there is presence at the inferior end, there is presence of a canal on both the sides which is called as the carotid canal. So the carotid canal runs along the petrous temporal bone which runs forwards and medially. So the inferior surface of petrous temporal bone is perforated by lower end of carotid canal. So this is the lower end of carotid canal. So this is the carotid canal. So foramen lacerum, it is anteriorly bounded by root of pterygoid process and greater wing of sphenoid. This is foramen lacerum. Anteriorly there is presence of root of pterygoid plates and the greater wing of sphenoid adjacent to it. It is a short wide canal which is 1 centimeter long, and the lower end is bounded laterally by apex of petrous temporal bone. Laterally there is presence of apex of petrous temporal bone, and medially there is presence of basi-occiput. Basi-occiput or the basilar part of occipital bone. So this is the foramen lacerum. Now foramen lacerum, what important structures does it transmit is the Vidian nerve, that is that is formed by the fusion of greater petrosal and deep petrosal nerves, then internal carotid artery and sympathetic plexus of nerves which are present around the internal carotid artery. So these structures pass through foramen lacerum. Then carotid canal, it again it transmits internal carotid artery, then nerve plexus which are present around the internal carotid artery and the venous plexus. So these are the structures passing through these foramina. Now next, coming to tympanic plate. Tympanic plate is a small plate or projection which is also triangular in shape, and it is a triangular curved plate which is present between petrous part of temporal bone. This is the petrous part of temporal bone and the squamous part of temporal bone. The rest is the squamous part of temporal bone. This is the squamous part of temporal bone and this is the petrous part of temporal bone. So in between these there is presence of a triangular curved plate which is called as tympanic plate. The apex of this tympanic plate is directed medially here and here also. It is directed medially. The base is curved, free and roughened. The base of this tympanic plate, this is curved, it is free and it is roughened. The posterior surface is concave. The posterior surface of this tympanic plate, it forms the anterior wall, floor and lower part of the external acoustic meatus, bony part of the external acoustic meatus. The anterior wall, the floor and the lower part of external acoustic meatus. Then the anterior surface forms the posterior wall of mandibular fossa. This anterior surface of tympanic plate, it forms the posterior wall of mandibular fossa. This is a depression which is present in the squamous temporal bone. This is the mandibular fossa. So the anterior wall of tympanic plate forms the posterior boundary of the mandibular fossa. The upper border of tympanic plate bounds the pterygotympanic fissure and the lower border is sharp and free. Then medially the tympanic plate, it passes along the lower end of carotid canal. Passes along the lower end of carotid canal is this portion. Upper end is somewhat here in the apex of petrous temporal bone. So this is the lower end of carotid canal. So the tympanic plate passes along the lower end of carotid canal, and laterally it forms the sheath of styloid process. So there is this styloid process. So laterally this tympanic plate forms the sheath of styloid process. So this is the tympanic plate. Now in this petrous temporal bone, this is the squamous temporal bone and this is the mandibular fossa and articular tubercle. So mandibular fossa is the part of squamous temporal bone, and there is a tubercle at the anterior root of zygoma here, which is called as the articular tubercle. It is a projection in front of the mandibular fossa. Now part of the petrous temporal bone, it gives a projection which is called as tegmen tympani, and it is a downturned edge of petrous temporal bone. It is seen in the squamotympanic fissure. So there is a fissure between the squamous part of temporal bone and the tympanic plate, which is called a squamotympanic fissure, and a projection of petrous temporal bone runs into this squamous tympanic fissure which is called as tegmen tympani, and it divides this fissure into petrotympanic and petrosquamous fissure. Now the squamous temporal bone has two main structures, the mandibular fossa and the articular tubercle. This is zygomatic arch, as we have already studied the zygomatic arch and the most part of the squamous temporal bone. So with this we come to an end of the middle part of norma basalis. with both the median area and the lateral area have been covered. And so the next video will be about the posterior part of norma basalis. Thank you.